Good evening, everyone. I'm Dr. Michael Twyman, a board-certified cardiologist, and I focus on the heart attack and stroke prevention. I'm located in St. Louis, Missouri, and I founded Apollo Cardiology in the summer of 2019 to focus on cardiovascular risk reduction. So I like to help people invest in their health, try to get to the root causes of what might put them at risk of having a heart attack and stroke, and reversing those problems. So tonight I'm going to teach you about the 3 best tests that can help with reducing your risk of having a heart attack or stroke. So it looks like we're waiting for a few more people to come on. So good evening, good evening. All right. I'm waiting for a few more people to come on, but just introducing myself, I'm Dr. Michael Twyman, and tonight we're going to be talking about heart attack and stroke prevention and what tests you can get to optimize your ability to know if you're low or high risk of a stroke or heart attack. And if it's dark where you're at, you should go outside and look for the 2 planets coinciding with each other. You're never going to see it again, unless you're really good at longevity. All right, we'll wait for the other ones to, I should say, I'm not going to wait for the other ones. If they're catching the stars at school, they can see this on replay. So tonight we're going to talk about 3 main tests that really help you define what your risk of a heart attack or stroke is. Those 3 tests are the CT coronary calcium score, the carotid intimal medial thickness scan, and the endopat, which is an endothelial function test. So we'll start from the earliest stages to the middle stages to the late stages. So what is atherosclerosis? Fancy word for disease in your heart arteries or your the rest of your 60,000 miles of blood vessels. But plaque is not like a sewer pipe just filling up in the artery and then all of a sudden you have an event. It's more that the walls of the artery get sick first, they're inflamed, ApoB containing particles deposit their payload into the walls of the artery, and plaque starts building up. But what's supposed to prevent that from happening is the endothelium. The endothelium is 1 cell thick. It lines the inner walls of your arteries, and if you took out all your endothelium, it'd be approximately the area of 6 tennis courts. So it's one of your largest organs. And one of the most important things that the endothelium does is release nitric oxide. Nitric oxide is a gas that dilates your blood vessels, prevents stuff from sticking to the blood vessels, and also helps lower the blood pressure. So if the endothelium gets dysfunctional, it stops releasing that nitric oxide, then more things start sticking to the walls of the artery, and more likely to start building up into the walls of the artery. So the endothelium can get damaged many years before plaque really starts forming in the arteries. So there's a test that can be performed called an endopat, which is an endothelial function test. Essentially, there's 2 probes that are on your fingers, measuring the flow in each fingertip. There's 5 minutes of a warm-up period. Then there's 5 minutes of a blood pressure cuff being pumped up over your systolic blood pressure. Cuts the blood flow off for approximately 5 minutes, and then we watch the baseline of your other hand going up and down. The other one is a kind of a flat line. And after 5 minutes, we open up the blood pressure cuff. The blood rushes back down to your hand. You get what's known as reactive hyperemia. And when that happens, the blood hits the small blood vessels. The small blood vessels then release nitric oxide to dilate to accept that blood flow coming down into the hand. And the test measures how much the arteries can dilate. So your arteries should increase by at least 68%, but doubling in size is optimal. So if your arteries are not doing that appropriately, then you have endothelial dysfunction and you're at much increased risk that plaque will start developing. So the endopat test, non-invasive test, it's the #1 test you should get if you're under the age of 40 and want to know how healthy your arteries are, or if you've already had a heart attack and stroke and you want to know, have you done everything from a lifestyle standpoint, supplement standpoint, or medication standpoint to reduce your risk of having another event. The endothelial function test is right for you. The second test we'll discuss tonight is the carotid intimal medial thickness scan, the CIMT. It's an ultrasound of your neck artery. Some people might have had a carotid duplex study before, same piece of technology, but that is looking at the flow of how fast the blood is going through the artery. By the time that test is abnormal, you generally have a very significant blockage in one of your arteries, typically 50–70% blockage in one of your arteries. So the carotid intimal medial thickness scan is a test that's looking at the wall thickness of the artery. That artery, the intima, generally should be less than ½ millimeter thick. The thicker it is, the more inflammation is in the wall of the artery. You can also see evidence of soft plaque that's building up there. And the soft plaque generally is the more vulnerable plaque. So the CIMT test will give you a vascular age. So if you're a 45-year-old man, but your arteries are 65, you're as old as your arteries. Excuse me. So the CIMT is good to get at a baseline, implement some type of change in your lifestyle, your supplements, your medications, recheck that CIMT in 1 year, and if things are going according to plan, you can see that thickness decreasing, you can see plaque decreasing. So the arteries are getting healthier, they're getting younger, so you're essentially reverse aging. That's the second test. The third test is called the CT coronary calcium score, or calcium scan. That's a low-dose CT that's looking at the arteries on the outside of your heart. Heart's about the size of your fist. There's 3 arteries that sit on the outside of it that provide the nutrients to the heart muscle itself. If those arteries are starting to calcify in the walls of the artery, that indicates that plaque is building up in those arteries. So the calcium score test, the CT scan, if you have a calcium score of 0, there's no definitive hard plaque building up in your coronary arteries, and you're very low risk of a heart attack or stroke. The reported incidence of a heart attack or stroke if your calcium score is 0 would be 0.4% over 5 years. So it's somewhat of a kind of 4x4 matrix. If you're under 40 with a calcium score of 0, that's expected. If you have a score higher than 0, that's very unusual. You're much higher risk. Now, if you're like over the age 80 and your score is 0, normally you should have had a positive score. About 6 out of 10 people would have a positive score by that point, probably even higher. So if you're 80 years old with a calcium score of 0, then you're actually pretty low risk from a cardiovascular standpoint, and maybe you shouldn't be on aggressive medication therapy for things unless there's other high-risk findings along with it. But back to, calcium in the arteries, it indicates that there's soft plaque present and the body's trying to repair that damage. And the late stages of that, the calcifications are basically somewhat trying to seal in that plaque so that it doesn't rupture. So plaque in your arteries can be common. You got 60,000 miles of blood vessels, and the plaque, it's like a little pimple on the wall of the artery, and there's a cap over it. If that cap ruptures and all the damaged content spills out of the bloodstream, a blood clot forms. So the body's trying to put a thick cap over any of that plaque to try to seal it into the wall of the artery if possible. So the CT coronary calcium score test is a good test to know, are you low risk or high risk of a heart attack? And that test is generally indicated for people over the age of 40. Caveats, who shouldn't get a CT coronary calcium score? Somebody who's already had a stent, a bypass, and already indicated to be a high-risk person. The calcium score test isn't going to give you more information to let you know that you should do something different. You just treat that person as high risk. So those are the 3 tests that I would recommend. Pretty much anybody over the age of 40 consider the EndoPAT test to look at your endothelial function, the CIMT or the carotid intimal medial thickness test to look at the thickness of the wall of your carotid artery, which is a marker for soft plaque, also giving your vascular age. And the third test is called the CT coronary calcium score or calcium scan, looks for calcifications in your coronary arteries. So that's what I want to share with you guys tonight, and then I would like to open it up to any questions we have. So if you're on Instagram, you can just type it into the comments. If you're on my Zoom call, there's a message board open, but I'll also allow you guys to unmute yourself if you like. All right. So for those that were outside looking at the planets, this is being recorded as always. I'll put it up on the YouTube channel by tomorrow, and it'll be on the Instagram live replay and on my IGT TV. So far, no questions. That's all right. So I won't keep everybody here if we're not getting questions tonight. That's I just wanted to kind of jump on here real quick, give you the idea of the three main tests to consider. If there's something you guys need in the interim, just shoot me a message. But here we go. Here comes the questions, of course. All right. One question. So, what is the calcium score good, but not the CIMT? I guess it's probably a question more of like, when is the CT calcium score good, but the CMT is not? So if you have a calcium score of 0, that indicates that you have no hard plaque in your coronary arteries, but you can still have an abnormal CIMT. The CIMT is kind of an earlier stage of vascular disease or vascular injury. So if the arteries are inflamed for whatever reason, you have sleep apnea, you have a poor diet, you don't exercise, you have heavy metal toxicity, a chronic infection, something that causes your body to be inflamed, the arteries get damaged in the process of carrying those inflammatory markers through, and you start seeing damage in the carotid artery wall. So there's things you can do from a lifestyle, supplement, and potentially medication standpoint to get that to heal down. So if this improves, you're never going to go on to necessarily put the hard calcified plaque into your coronary artery. All right. There's a question, after the calcium is formed, is there a way to reverse that? Yes, it's somewhat of a kind of gray zone in that many times the goal literally is just to make sure that things aren't getting worse. And really the main thing is don't have events, don't have a heart attack or stroke. So the test is done to kind of re-stratify somebody as low risk or high risk. They have a high risk calcium score, typically indicated over a score of 400. There's many things that can be done to help start stabilizing that plaque. And I have seen it in my own practice, but this isn't reported that routinely, that I've seen people with scores that are well less than 100. I have seen the scores go back down to 0. It's not that common. I've seen it maybe just a handful of times. But most of the times, if you don't do anything, the calcium score test will keep increasing 20-25% a year. The goal is just to kind of freeze it in place. There are some data that statins, which are a tool to be used in times of people with high-risk calcium scores, that will cause the calcium score test to go up. The statins are thought to basically turn the soft plaque, the stuff that's more vulnerable and likely to cause a heart attack or stroke, into a calcified plaque. And when the plaque is calcified, it's less likely to rupture and cause a heart attack. So your calcium score test might be going up, and potentially people would think you're going to be higher risk. But if your calcium score is going up, and your blood tests show that your ApoB particles are normal, your inflammatory markers are normal, your glucose regulation, insulin are all normal, then you probably actually are not at increased risk. All right. And somebody's asking about kind of a photobomb modulation question. It's a great device that you're ordering. I do have a website called redlightdoc.com, and I've done previous talks on how to use light for either musculoskeletal reasons, for brain health, or for cardiovascular health. But it depends on which type of, it looks like you got the fire wave. Depends on what you're trying to treat, but typically the distance that I use for most things is between 12 and 15 inches. All right. Hello, Tampa. So who went outside and actually looked at the planets? Got one person. So somebody in Boston, that's good. My little brother's in Boston. Somebody just got back from being in nature, that's good. So, yeah. Somebody says no telescope, but they saw it. Yeah, that, I mean, I wouldn't say I'm disappointed in it, but after the total solar eclipse a couple years ago, when it was actually like an awe-inspiring moment, this was more like, oh, yeah, I can see it. But I guess, yeah, if you had a telescope and could see the rings, maybe that'd be much more cool. Anybody have any questions off topic tonight? All right. Well, I thank you guys for joining me tonight. I know there's one other question coming in. I'll answer before we log off. But I wish you guys a Merry Christmas, Happy New Year, Happy Hanukkah, Happy Festivus, whatever you guys celebrate. I wish you the best. We'll be open through the holidays other than Christmas Eve, Christmas Day. But if you need anything, just of course, just call our office, send us a message, and we'll make sure everything's taken care of. Next week, Monday, I don't have a topic, totally picked out the top of my head yet. But if you have a suggestions, shoot in the comments, send me a direct message, and maybe you might be the big winner and get to pick the topic next week. All right, we got 2 more questions. Let's see what we got. It's actually a good question there from Tampa. So, how does blue light come off the planets affect your sleep? Just kidding. Well, ideally, if you're outside post sunset, you would still wear the glasses because of the artificial light coming off of street lamps and cars with bright LEDs. So I would still just wear the glasses, but that's actually where the word lunatic comes from because of the light bouncing off the moon, and that's the greatest amount of blue light at nighttime that you'd be exposed to outside. So I guess potentially, if you're sitting there staring at these 2 planets for a couple hours tonight, it might affect your sleep. So yeah, put your blue blockers on if you're outside. Oh, and you're very welcome. Thank you guys for joining tonight. So I'll sign off and have a Happy New Year, and we'll see you next Monday.